All right, I'm recording. So my name is Lexi Graham, and today we're going to be talking about in video 2 of pulmonary. We're going to talk about pulmonary blood flow. So pulmonary blood flow and the factors related to it. These are kind of the key points of this video. We're going to talk about gravity zones 1, 2, and 3. We're going to talk about pulmonary vascular resistance, Puccelli's law, cardiac output, ventricular preload and afterload, and then myocontractility of the heart. First, we're going to talk about gravity's relation to pulmonary blood flow. So it plays a significant role in the distribution of pulmonary blood flow, causing more blood to flow to the base of the lungs, which is the bottom, rather than the apex, which is the top, due to hydrostatic pressure. Due to the hydrostatic pressure difference created by gravity, meaning the lower part of the lung experience greater blood flow because of the downward pull of gravity on the blood within the pulmonary vessels. This phenomenon is often referred to as the zone model of pulmonary perfusion. Blood enters each lung through the pulmonary artery, which is about midway between the apex and the bases of each lung. Because it enters midway, the pulmonary artery pressure must be greater than 15 centimeters of water to overcome gravity in order to supply some of that blood to the top of the lungs or the apex of the lungs. So I have drawn out a model for you of the lung zone model with lung zones 1, 2, and 3 on it, and it tells you all the pressures on the side right there. I also have it in my hand. So lung zone 1, the alveolar pressure is the highest due to the lung's natural tendency to expand at the top. If the pulmonary artery pressure is low, then the alveoli can compress the capillaries, limiting blood flow. Lung zone 2, the pulmonary artery pressure is greater than alveolar pressure, allowing blood to flow, but the pressure difference between the two determines the flow rate. And then lung zone 3, both arterial and venous pressures are greater than alveolar pressure, resulting in the highest blood flow in the lungs. Next, we're going to talk about pulmonary vascular resistance. This is defined as resistance against blood flow from the 4 pulmonary veins of the lungs into the left atrium. Input pressure represents mean pulmonary artery pressure, which is 15 millimeters of mercury. And then the output pressure represents the pulmonary venous pressure equal to the pulmonary capillary wedge pressure or left atrial pressure, and that is 5 to 6 millimeters of mercury. The total blood flow represents the cardiac output. A normal value for pulmonary vascular resistance using conventional units is 0.25 to 1.6 millimeters of mercury, or it can be expressed in dynes, and that would be 37 to 250 dynes. An increased PVR also directly increases ventricular preload. This particularly affects the right ventricle as it creates a higher pressure in the pulmonary circulation, hindering the amount of blood that can return to the heart during diastole, thereby reducing the volume available to fill the ventricle and impacting its preload. Part 2, PVR. When PVR is increased, the blood pressure also increases. So this also increases the ventricular afterload, which is the amount of pressure and resistance the heart experiences when pumping blood out of the ventricles. This is a major factor on how much blood the heart pumps with each beat. So the equation for pulmonary vascular resistance is mean arterial pressure over cardiac output. Next, we're going to talk about Puccelli's law. In this equation, it represents the length of a tube or vessel, its radius, and the fluid's viscosity, which is how thick it is. Puccelli's law clarifies the impact of the radius on resistance. So how big it is going to determine how much resistance there is. So in more simplified terms, this law states that flow depends on length and radius of the tube, pressure gradient, and viscosity of the fluid. So that means depending on how long or short it is, or how wide or small it is, and depending on how thick the fluid is how much pressure will be in this tube. These two right here are the equations for flow and pressure in Puccelli's law. And then As far as like the letters and numbers go, 3.14 is a constant, and then the letters. So Q is represented by, or P is the change in pressure, R is the radius, N is viscosity, and L is length. So the best way I could describe Pucell's law, as you can see in this picture, would be, it's like a water hose almost. So like if you have a longer pipe, or if you have a longer hose and the hose is wider, then you won't have as much pressure. But if you have a smaller hose or a shorter hose and a smaller radius, then the pressure you'll have a higher pressure. So it's literally like the wider, the longer, less pressure, smaller, shorter hose, more pressure. Next, we're going to talk about cardiac output. This is the amount of blood the heart pumps in 1 minute via the ventricles. This is equal to the stroke volume times heart rate, which is SV times HR. That's the equation for cardiac output. And then there are three things that determine cardiac output, which are ventricular preload, afterload, and myocardial contractility. I know we just talked a little bit about preload and afterload in the last ones. We'll talk a little bit more about it. Ventricular preload is described as the initial stretching of the cardiac muscle cells prior to contraction. It is related to ventricular filling. Ventricular afterload, that is the force or load against the heart that has to eject the blood out. So it goes down the aortic pressure and SVR and then decreases through vasodilation. And in myocardial contractility, this factor is the intrinsic strength of the cardiac muscle independent of preload, but a change in preload will affect the force of contraction. It is the force generated by the myocardium when the ventricular fibers have shortened. So in summary, just going back to the three lung zones, gravity, Pucell's law, and then the pulmonary blood flow, cardiac output, and pulmonary vascular resistance. Without all of these things, your lungs will not get the oxygen it needs to thrive. So without all of these things, if these pressures aren't normal, if you have high resistance, or the pressures in these having to do with the preload and afterload in cardiac output, if these pressures are too high, that could inhibit your oxygenation and the distribution of that throughout the blood, like the blood flowing through your body. So all of this to say is, without all these values being normal, you will not oxygenate properly, and your organs might not thrive. Thank you for watching.